All right, gentlemen, if your ambition is to become an exceptional lover and guide a woman toward truly intense, mind altering orgasms, there's a specific oral sex technique you absolutely must integrate into your repertoire, a technique that surprisingly most men remain unaware of. In this lesson, I will meticulously detail exactly what this technique entails and provide you with a clear 3 step guide on how to execute it flawlessly. Should you diligently follow these 3 steps when engaging in oral intimacy, you possess the power to orchestrate a profoundly orgasmic experience for her, one she will undoubtedly cherish and remember forever. We're talking about the kind of climax that leaves her trembling, gasping for breath, and utterly drenched in pleasure, all while looking at you as if you are the sole man in her entire world. I'm Dr. Emma Blake, your expert in urology and men's health, and I am here to navigate you through the essential anatomy, optimal pacing, and rhythmic precision that elevates oral sex from merely good to truly extraordinary. Before we delve into the mechanics of technique, two foundational elements are absolutely critical: consent and comfort. Always initiate with consent, but do so in a way that maintains the sensual energy. A simple yet effective query could be, "Would you like me to taste you?" And throughout the encounter, incorporate brief, gentle check ins such as, "Would you prefer it softer or firmer here?" or "a little higher?" As for comfort, it is paramount that both of you establish positions you can sustain for an extended period. Exceptional oral intimacy is not a hurried sprint. It's more akin to a gradual, deliberate climb. If your neck or jaw begins to ache after just 3 minutes, you simply won't be able to complete that ascent. Step one, ensure both of you are positioned comfortably. Many women discover the most profound pleasure when lying on their back, with a pillow strategically placed beneath their hips to gently tilt the pelvis upwards. This slight elevation not only enhances her responsiveness, but also provides you with superior leverage. Encourage her to spread her knees comfortably wide. Greater hip abduction generally translates to improved access and typically a heightened sensation for her. Now, it is equally vital that you prioritize your own comfort. If you are kneeling, consider placing a pillow beneath your knees. Should the bed height prove awkward, subtly angle her towards the edge, allowing you to sit comfortably in a chair or kneel on the floor. Alternatively, working from the side of the bed might enable your neck and shoulders to remain completely relaxed. The underlying principle is straightforward. If you cannot breathe with ease and maintain a relaxed jaw, fatigue will inevitably set in. Arrange your environment to facilitate smooth, uninterrupted, and consistent movements for as long as the experience demands. Step two, the patient buildup. Truly exceptional oral intimacy requires ample time. Many women typically take approximately 10 to 15 minutes to reach climax through oral stimulation. Sometimes it's more, sometimes less. This means you must consciously pace yourself, resist the urge to rush directly to the clitoris. Instead, tantalize your way in. Begin with slow, tender kisses and light, playful nibbles on her inner thighs. This often overlooked area is densely packed with nerve endings, and most men tend to bypass it. Gradually work your way closer, then gently retreat. Think of it as taking 2 steps forward and 1 step back, allowing her body to subtly guide you to the next stage. When you first make contact with the vulva, refrain from immediately applying maximum pressure or speed. Instead, initiate by gently circling the outer labia with soft kisses and delicate licks. Subsequently, trace the contours of the inner labia. Your objective here is to meticulously build anticipation and enhance blood flow. As you begin to lick the full length of her vulva, initially employ only the very tip of your tongue, moving from bottom to top. Maintain a pace slow enough that you could count 4 or 5 distinct beats per stroke. The tip of the tongue is inherently gentler. The broader top surface of your tongue is coarser and should be reserved for later stages. Envision savoring your most cherished ice cream rather than simply shoveling it in. After 2 to 3 minutes of these deliberate, slow, tip of the tongue strokes, you can gradually expand the contact surface. Introduce the broader top of your tongue for a touch more pressure, then gracefully revert to the tip. As she visibly warms and responds, Begin to direct more attentive stimulation toward the clitoral hood, but still consciously avoid direct exposed pressure on the clitoral glands unless she explicitly requests it. The majority of women prefer you to work through or around the hood during the initial phases. Continue to incrementally increase both pace and pressure. Remember, the clitoris is the most exquisitely sensitive structure in her entire body. Therefore, steady, consistently repeatable patterns will become your most valuable ally. Once you discover a pattern that causes her hips to subtly lift or her breath to catch, commit to that rhythm. Consistency is what builds arousal. Randomness, conversely, tends to reset it. This is a common pitfall where many men err. They abruptly alter the rhythm just as it begins to elicit a powerful response. Do not interrupt the accumulation of pleasure. If she enjoys a gentle sealing sensation, you can introduce light suction on the clitoral hood, alternating between a gentle suck and a smooth glide with your tongue. If she prefers a broader touch, widen and flatten your tongue. If precision is her preference, revert to using just the tip. Maintain a loose jaw, breathe steadily through your nose, and keep your shoulders relaxed to ensure your movements are fluid and unhurried. Step 3, the start and stop method, or the edging finish. Most men, upon sensing a woman is nearing climax, tend to push straight through to the finish. While she can indeed climax in this manner, if your goal is to facilitate that intense body trembling release, it is often far more effective to pause just before she crosses the point of no return. Allow her to gently settle for 20 to 30 seconds and then meticulously build her back up again. Here's how to precisely time this. Diligently observe and listen for her telltale cues. These include louder moans, her thighs beginning to involuntarily clamp, a tightening in her belly, her breath becoming shorter and more rapid, her perineum visibly pulsing, or her hands gripping the sheets tightly. When these cues suddenly intensify, maintain your established pattern for a few more seconds and then gently ease off. Crucially, do not abandon her. Instead, transition to soft kisses on her inner thighs, lower belly, hips, or nipples while whispering something warm and tantalizing in her ear. Phrases like, "You taste so good," "I love how your body moves when I touch you," or "I'm going to do that again," can be incredibly potent. After this brief period of rest, return to the exact same pattern, pace, and pressure that previously brought her to the very precipice. Repeat this start and stop cycle 2 to 3 times. The initial ascent to the edge might take 10 to 15 minutes, but each subsequent ascent will be considerably faster, as arousal is a compounding phenomenon. On the final round, absolutely do not alter anything. Maintain that steady rhythm and gently carry her over the edge. If you have accurately interpreted her cues, her release will be powerful, often accompanied by involuntary tremors, rhythmic pelvic pulses, and a deep, fulfilling exhale. Now let's discuss crucial refinements that significantly amplify results. Keep your hands actively engaged. One hand can gently splay the inner labia to further expose the clitoral hood. The other can gently cup her hip. You can apply subtle counter pressure just above her pubic bone or slide your hand beneath her lower back to gently lift her into your mouth. Consider using a lubricant if she prefers a silkier, more effortless glide. Flavored, water based lubricants can make extended sessions more comfortable and enjoyable for both of you. Should her clitoris become overly sensitive, immediately broaden your point of contact. Use a wider tongue, apply lighter pressure, and return to stimulating the inner labia and the edges of the hood for a minute before cautiously revisiting the center. If she enjoys blended stimulation, try anchoring a "come here" fingertip inside her vagina while your mouth maintains the precise clitoral rhythm she is responding to. Remember, tiny movements go a very long way. Resist the urge to turn your fingers into a piston. If she subtly tilts her pelvis, follow her lead. If she gently pushes your head away or freezes, ease off immediately and offer a concise 5-word check in. More or less, here or higher, then adjust accordingly and continue. Hygiene and comfort are paramount. Ensure short, smoothly filed nails, impeccably clean hands, fresh breath, and have a soft towel, tissues, and water readily accessible nearby so you never have to break the moment to search for supplies. If you have touched the anal area, wash your hands thoroughly or change gloves before returning to the vulva. Always maintain an environment that is both safe and alluring. Positional adjustments are welcome if either of you experiences cramping. Gently roll her hips, reposition the pillow, or subtly alter your knee height, all without disrupting your calm, consistent rhythm. What you articulate also carries immense weight. Employ short, present tense phrases to help her remain deeply immersed in her physical sensations. Examples include, right here, you like that pace? Stay with me. Offer genuine praise for her responses. That sound, don't hold it back. I love how you taste. Give me all of it. After the climax, resist the urge to abruptly pull away. Gradually ease off the pressure, transition to warm palms and gentle kisses, and softly hold her thighs or waist as her body slowly unwinds. Offer her water, kiss her, allow the beautiful aftershock to gently settle. This is the hallmark of truly extraordinary lovers, maintaining a steady presence all the way through the landing. If you are navigating a dry spell or actively working to rebuild your confidence, the single most effective way to improve is through mindful practice. Pay close attention to her cues. Consistently maintain the pattern that elicits her pleasure. Build the arousal slowly and deliberately. Edge her two distinct times, and then finish strong. This approach is not about employing mere tricks. It is fundamentally about cultivating patience, precise rhythm, and genuine care. When you master and deliver this powerful combination, you will unequivocally feel the profound difference in her breath, in her body, and most tellingly, in her eyes. And if you'd like natural support for the physical aspects, circulation, stamina, and erection quality, two options that men frequently inquire about are organic watermelon extract, rich in L-citrulline to support nitric oxide and healthy blood flow, and an advanced performance formula that skillfully combines Icarian, Tonkat Ali, fenugreek, nettle, and citrulline to support robust erections, enhanced stamina, optimal testosterone levels, and overall prostate health. You'll find direct links to both of these in the comments section and within the video description. Thank you for watching.